This lesson, we're going to be talking about the important factors for a successful treatment. In this lesson, you should be able to describe the factors that influence treatment success and understand and apply these factors in the U.S. context. This chart here demonstrates that there can be a substantial variation in the success of a given treatment program, regardless of the treatment setting. So long-term residential rehabilitation treatment, along with outpatient drug-free counseling and outpatient methadone treatment, have comparable levels of retention amongst the best programs. But there is a significant difference between successful and unsuccessful programs for each of these three types of treatment in terms of retention. The long-term residential rehab facilities in this chart were voluntary treatment programs, not those provided by government rehabilitation centers. So in the chat box below this video, I'd like for you to put your comments on what do you think are the factors that lead to these differences. There are a number of individual client factors that can contribute to or hinder the success of a treatment program, like long-term users with severe addiction to multiple drugs who also have psychiatric disorders, they are less likely to have successful treatment outcomes. And also users who lack non-drug using social networks or family support are less likely to have successful treatment outcomes. And none of these factors is necessary for poor treatment outcome, and presence of one or more of these factors should not be used to discriminate against who receives treatment. But it's important that we're asking these questions up front so that we can understand, because they have a higher likelihood of relapse or continuing their drug use. And some of the other factors that relate to treatment outcomes are going to include the number and the type of services provided. So treatment outcomes may be affected by whether or not the services are linked to other health and social support programs like HIV counseling and testing, or peer education, or case management. Then there's also the program organization. Like if the paperwork, the enrollment procedures, the rules and requirements, if all of that's too complicated, the clients are not going to be inclined to initiate or continue with the program. Also, the leadership qualities. Team cohesion and management is going to really affect the treatment outcomes. And I've seen this time and time again in different organizations, where if management is not doing what they're supposed to be doing and the team is not cohesive, then the clients start to manipulate the staff, and then it just ends up in relapse. Also, a mix of the staff skills. Treatment outcomes are going to depend on how well trained the staff are and whether or not they bring a variety of experiences and skills to address the client needs and the client's issues. If somebody's not trained in rapid eye movement therapy, that may be beneficial to somebody who is experiencing trauma. And so if you have somebody in your treatment facility who is experiencing trauma, then it would be good to have somebody that is trained and knows how to do rapid eye movement therapy. Also, the environment. The physical and the social environment is going to be crucial. The treatment outcomes are going to depend on whether or not the clients feel comfortable attending the services in the treatment environment, including the cheerfulness of the physical space and the reception that they receive when they're coming for services. If they're treated poorly on day one in the very beginning and they're having to wait in a cold room, or it's dingy, or it's not conducive to a recovery environment, then they're not going to want to stay, and they're going to leave, and they're going to relapse. So treatment outcomes are going to depend primarily on the quality of the treatment services rather than just on individual factors of the client. And does this really surprise you? And if it does, discuss that in the chat box below. And I'm encouraging you guys to challenge this statement and come up with reasons why you might disagree if you do. So if the service quality is poor, treatment outcomes are also likely to be poor. So the next few slides are going to address some of the key elements that need to be in place to ensure treatment services are of good quality. But this slide shows some of the essential organization qualities that need to be in place to deliver quality treatment services, like basic management skills. The team leader should have a really good understanding of organizational theory and practice and some sound management skills. It needs to be a healthy working environment. The work environment should be welcome for both the staff and the clients, and that's going to include addressing any safety concerns. And then there needs to be a clear demarcation of tasks. Every member of the team should know what their role and responsibilities are, as well as what the roles of each of the other team members are. And any concern about overlapping areas of responsibility need to be resolved. I've worked for an organization where there were multiple managers for different things, and one manager would tell the staff to do one thing, and then the other manager would tell the staff to do something different, and it led to confusion and frustration, and they had a high turnover at that organization. And the team members need to understand the team mission and responsibilities to clients. The team should meet regularly to discuss client progress and solve team-related issues. I've seen some companies where they meet every day, and I've seen companies where they meet once a week, and some companies they meet once every 2 weeks. So it kind of depends on what your organization calls for, but it does need to be quite frequently that the team gets together to discuss what's going on with the clients. You don't want one client saying something to one team member and then something different to another team member. Communication is a must. And the team members need to have a solid understanding of the purpose and the goals of treatment. And the staff need to be well supervised and appraised and supported. The leadership here is going to be key. The team leader should lead by example, but also spend time with the staff to assess their skills and respond to any gaps that are identified. Mentoring and supervision are going to be critical for maintaining staff productivity and job satisfaction and for obtaining positive treatment outcomes. If you don't know what the issues are in your organization, how are you going to fix them? So speaking to your staff and having an open door policy and letting them tell you what's going on and what could be fixed or what's going wrong, that's going to be key in keeping the organization running successfully. So just to review, treatment outcomes are going to be related to the program organization, the leadership, and the clarity on the organization's purpose and goals, and a mix of skills with the staff. It's also going to be related to the duration and intensity of the treatment, and the individual's readiness to change and the problems at the beginning of treatment, and the level of compliance and the degree of engagement in the treatment program, and also the type of structured counseling or other social interventions. And the factors that are going to impact the treatment outcomes are going to be, well, we'll start with the client factors, the severity of their addiction, multiple drug addictions, the severity and nature of any coexisting problems, the level of social and family support, and also their readiness to change. And the clinic factors that are going to impact treatment outcomes are the quality of leadership and teamwork, the treatment environment and setting, the range of services, and the skills mix of the staff. It's going to be important to just reemphasize here that program-related factors have a greater influence on treatment outcomes than individual factors. If you have any questions or comments, please feel free to put them in the chat box below this video in the lesson.